Stem cells should be treated like a drug. Umbilical cord stem cells, they're like a universal donor. They're not embryonic, so they can't cause cancer. These guys are just simply messengers that allow your body to heal itself. Between the ages of 20 and 40, you want to get your cells collected. The genes that are turned on are the most optimal they're ever going to be. As you age, you can start to reintroduce those cells so that you're getting back those younger versions of yourself. Putting biologics in your body, you name it, we can inject it. Everything we do is targeting the outer, but also the internal, how our body functions and ages, reducing inflammation and reducing damage. That's why I love regenerative medicine so much.
Athletes, astronauts, people that wouldn't be doing what they're doing, whether they're tennis players or soccer or football, had it not been for regenerative medicine by stem cells.
Absolutely. Everything in terms of regenerative medicine, I'm a believer in. It's all fantastic. None of it's bad. It's just various levels of quality, right? So PRP may be a 2, exosomes like a 5 or a 6. A live stem cell is going to be a 10 because of its regenerative qualities, capabilities to reduce inflammation, emit exosomes, secretomes, do cytokine, all of those amazing things that a live stem cell can actually do. And so I started with RMI in 2021. It was right after COVID. I've been in healthcare personally for 15, going on 16 years now. I did the traditional medicine side. I worked for the spine docs, the orthopedic surgeons, the hospitals, the surgery centers. And ultimately what I saw is that we weren't actually healing anybody. I felt like half of the people who came in for surgery came back 3 months later for something else that was caused by the surgery. And it just dawned on me. I was like, nobody's actually getting better, right? We're just kind of keeping them in this hamster wheel. And so when I discovered regenerative medicine six-ish years ago, I really began to see people heal. I saw people's lives change. I saw people get their quality of life back. And so at RMI, what we do, and it's in Costa Rica because we're licensed there. So there's something called the Minister of Health, that is their FDA. And it took 7 years to get a license to do what we do in Costa Rica. So fully government sanctioned, on the up and up, how to show safety and efficacy, which is the most important thing when you're talking about putting biologics in your body.
Costa Rica is like on the cutting edge of health in the entire world, right? I mean,
they have a whole area where med device companies operate out of it. It's
the biggest in the world. Johnson & Johnson, everybody, Medtronic, they're all in Costa Rica.
Yeah, it's large. So 2021 got the license, started operating. It was an idea. Two plastic surgeons had this incredible idea of how to actually make people younger at the root versus making them look younger. And so took it from nothing into what it is today. And we've treated thousands and thousands of patients successfully. We have an 80% success rate in terms of orthopedics, which after the age of 40, I'm 41 now. And after the age of 40, you just start to wake up and you're like, that's annoying me now. That's painful or that's stiff, right? And so everybody has it. And for me, what's so impressive and why I love it is because I can 100% say nobody has ever had a serious reaction or an adverse event. Light fever, some shakes, sure, things like that. But there has never been a serious adverse reaction, which is huge because cells need to be handled properly and need to be the bacteria, the sterility, the differentiation, all of that comes into play. So when you're looking at getting stem cells outside of the country or even in the country, you need to understand the lab that they're coming from. You need to be able to ask questions. And I can certainly share some of those questions with you if you want to share those with your listeners.
Let's do that because I have a very close friend whose husband went for stem cell treatment in Mexico. And guess what? He died. Okay. And I don't know all the details, but I know that when I went to RMI before doing anything, I wanted to meet the scientist and PhD in charge of the lab. And I was like, totally blown away with first her academic credentials, her research credentials. And then you go into the lab and the process of how they do it, how they care, how they identify the umbilical stem cells, how they follow the whole process, how they test everything. And then when you're going to get your treatment, this is cryo-frozen, how they take it out, how they test it to make sure that you're getting live and not dead cells. And you have to do it within a certain window, within the hour.
It's very intricate. This is not a vitamin C infusion, right? Like where you just pick up some vitamins and put it in somebody. There is a lot that goes into it, and the expertise of the person, to your point, running the lab, managing those quality assurances and controls. And what's really great is, and I love for people to understand this, stem cells should be treated like a drug. And what that means is there should be a standardized process that is followed. Just like when you take 200 milligrams of ibuprofen, you're like, I wonder if this is 120. You know it's 200 milligrams of ibuprofen. The
Right.
same goes for stem cells. When done properly, they are standardized so that every batch you produce follows the same protocols, ensures the same type of safety. And right before you administer them into a patient, you're looking for, again, bacteria, mycoplasms, sterility, differentiation, and viability. What percentage of these cells are alive?
Where they come from and why they come from where they come from. We both have a mutual friend has a public company and he supplies placenta to research universities. You guys have chosen a different path to do umbilical cords. Tell us why and this thing about the universal donor.
Sure, I'll
Why?
talk. I'll talk to both because Fountain Life has just recently started doing, as of July 1, the placental derived
Okay.
adherent cells. But Costa Rica, what's utilized are umbilical cord MSCs. So let me explain what that is. When a woman wants to have a planned C-section, there are OB-GYNs that we work with within the area. When a woman wants to have a planned C-section and she doesn't want to keep the cord, we are notified. The mom undergoes a screening process. When the baby is born, our team is actually in the OR. So again, this is a planned C-section. This is not a vaginal birth. When the baby's born, we're in the OR, we collect the umbilical cord and we take it immediately to our lab to ensure the sterility. Where the cells come from, this is not from the blood, okay? These are not a blood product. These are a tissue product. They come from inside the umbilical cord is the tissue, right? It's just the tissue called the Wharton's jelly. And in there are MSCs, mesenchymal stem cells, and many other types of cells. So we extract the mesenchymal cells from this tissue. What's really cool about these cells is they're not embryonic, first and foremost, so they can't cause cancer. That's complete. They're totally different types of cells. They're considered adult stem cells. They're just really, really young and potent. And they can only do three things. They can reduce inflammation, they can regenerate tissue, and they communicate with your cells. That's literally all that these guys can do. And they express no HLA receptors. An HLA receptor is what elicits an immune response. So if you gave me your cells, the HLA receptors would be off the charts. My body would be like, alert, 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 foreign, substance and object. Umbilical cord cells don't have that HLA expression, and we test for that actually, because that's what causes an adverse reaction, right? So anybody can get anybody else's umbilical cord stem cells. You don't need your children's. People ask me that all the time. It's not necessary. It does not matter. To your point, it's like they're like a universal donor. So again, it's not a blood product, it's a cellular product, and there is no matching required, and there's no transfer of genetic information or DNA. These guys are just simply messengers that allow your body to heal itself.
Right. Tell me about the different procedures because I've had 4 or 5 different ones that you can do.
The various ways that we broke up the treatments is like longevity treatments in terms of anti-aging, preventative, getting ahead of the aging process biologically, and then what I call the collateral damage of aging, right? So the longevity treatments are things like therapeutic plasma exchange, that's pulling out toxins and inflammatory particles from your body, as well as an IV of these mesenchymal stem cells in your arm that travel throughout your entire body and
Right.
are like little honing beacons to inflammation and damaged tissue. Those are what I consider like longevity treatments. The other treatments that address the collateral damage of aging are orthopedic treatments, right? We've injected anywhere from the occiput, which is at the very base of your skull, all the way down to your big toe. You name it, we can inject it. And you can do multiple injections at any given time. Also, sexual wellness. So we treat both men and women sexual wellness. As time passes, our blood vessels age like anything else in our body. So we've had really great results. Those are multimodality protocols, meaning we combine several different types of treatments to create this protocol to ensure the best results, such as an IV, injections, and hyperbaric chamber, right? That's just an example. We also have aesthetics. So skin, I do the skin every year, once a year. I absolutely love it. And we put the stem cells like one by one by one into your face and your neck. You are under propofol, by the way, so you're in a twilight, right? And that is regenerating naturally the collagen in your skin for outer appearance. But to your point, it also helps sun damage. It reduces um, the wrinkles, the fine lines, the texture. So everything we do is targeting both the outer byproduct external aspects, but also the internal, right? And how our body functions and ages and reducing inflammation and reducing damage. That's why I love regenerative medicine so much.
One of my close friends who is a ultra marathoner, he loves the TPE, what he calls the oil change,
The
which is
oil
really a
change.
blood change.
Start changing the water in a fish tank. That's how my yeah.
Tell us about that, and what does that, do for you?
So there are a lot of studies out there right now regarding the benefits in terms of longevity for therapeutic plasma exchange. It is an FDA approved treatment in the US for types of autoimmune conditions. 3/4 of your blood is your plasma. So essentially, what happens over time, whatever our liver doesn't process out gets stored in our plasma. So we accumulate toxins from think anything, drugs, alcohol, the environment, heavy metals, microplastics, right? Inflammatory particles and viral particles from any virus you've ever had in your entire life. There are particles that live in our plasma. And so the reason I think of it like a fish tank is because in the same way you wouldn't drop a brand new tropical fish in dirty water and be like, good luck to you for 10 years, our bodies are the same. If the environment in which our cells live in is not clean and they're fighting off things within the plasma, then it's not going to be able to do what it needs to do and perform at its peak because its environment is so toxic. So the idea is we remove 2 to 3 liters of the 5-ish liters of plasma you have in your body. It's an IV in each arm, separates the plasma, literally throwing it away. And people ask me, what's the difference between this ozone and EBU, right? The difference is we're removing it. This is not just a filtering and putting it back in. We're
Right.
physically removing 2 to 3 liters of the
And you
plasma
can
based
see
on
it.
the
It looks
individual.
pretty
You can
like,
hold it
oh
up, yeah,
man.
and then putting back in saline and albumin along with your blood, right? So at all point in time, you've got your blood circulating through. And albumin is a protein your cells need, and essentially your body reproduces new plasma. And so that one treatment alone removes 65% of those toxins and particles, which aids to and leads to an extension of health span and lifespan, essentially, right?
Yeah, and the other thing that I did with RMI was that I banked my stem cells, about 3 billion of them, and they break them up into little packets of maybe 250 million so
Mm-hmm.
that
Vials,
they
yeah.
can avoid contamination and all that. But and there's an optimal age to do that, which surprised me what that was. But tell us about why anybody would bank their stem cells. What is the optimal age to be thinking about it, and why should you do it?
Sure. So between the ages of 20 and 40, from an epigenetic standpoint, we are in our peak, right? We're meant to reproduce. At any given time, you have, only 30,000 genes are turned on, right? So between 20 and 40, essentially, the genes that are turned on are the most optimal they're ever going to be in your entire life. After 40, as we know, some of those genes will start to turn off, others will start to turn on, not in your favor. So from an epigenetic standpoint, you want to get your cells collected between 20 and 40. I did the same. I got mine collected at 37. And the idea is that as you age, you can start to reintroduce those cells so that you're getting back those younger versions of yourself. What is being worked on right now, and the reason we collect people even outside of the age of 40, is because there is new technology coming down the pipeline over the next several years. I don't know exactly when the date will be, but it is being worked on, and it's called cellular reprogramming. It's going to be a game changer, by the way. It's going to be a complete game changer. So I would say probably in the next 5 years, we'll see that. What we'll be able to do is take younger cells and epigenetically, they will secrete their younger epigenetic information onto your older cells and then epigenetically reverse the age of your cells into 30-year-old versions of yourself and give those back to you. It's really cool because the majority of what we collect are called hematopoietic stem cells. So those are your blood immune function stem cells. Mesenchymal stem cells are for your musculoskeletal system. So what we're collecting are your immune function cells. So really think about how our immune systems are affected as we get older, right? You can see it in family members and people we love where they get sick, it's harder to recover. This treatment will essentially combat that aspect of aging. So very exciting.